Hi everyone and welcome to the latest instalment in our Beauty Triangle in Clinic series. We're here with the brilliant Dr Munir Somji. We're here at DrMedispa, which is his incredible clinic, one of three. We're here in Loughton and you're also in
Knightsbridge and Marylebone.
Marylebone, exactly. Thank you so much for joining us.
Pleasure.
Always a pleasure to see you. And quite topically, it's January, so we are very much focusing on all things body. New year, new body, as the mantra goes, or new year, new you. I hate that saying personally. It does feel very catchy on a video. But really we're here to talk about what we're all looking for and seeking at this time of year, you know, be it renewed energy, a slightly more streamlined physique, just a general feeling of wellness and well-being. I mean, you're definitely the doctor to ask, so I'll throw it over to you firstly. What are patients seeking from body treatments at this time of year?
Well, I think that obviously we've all overindulged during the Christmas
100%.
time. So, but beyond that initial, I need to get back on track, the new year is a place to start. So you can really start a regime. And people sort out their diet, they look at their nutrition advice. For example, here at the clinic, we do DNA tests to see what you respond to in terms of your nutrition.
That's so interesting.
Before any body treatment, we actually recommend that for all patients, just to make sure.
You understand like the causative effects behind
Absolutely. I mean, it's a 5-minute mouth swab that's sent off, comes back after a week, and you get a whole list of foods that you react well to and foods that you don't, and what you should be ingesting. And looking at your genetics, it will also tell you what sort of type of exercise you should be doing to get the best out of your regime, and also looking at your body, how much fat you're eating, your macros, your fat, your protein, and your carbohydrates, and it puts it together for you. So that's what you do outside of the clinic. And we exercise, but sometimes you hit a roadblock, and that's where clinical help comes into it.
And what are the things that patients are complaining of specifically when it comes to their bodies at this time of year? Is it that feeling of lethargy and tiredness? Is it the weight gain, the pounds that have come on over Christmas?
Well, one of the things that we've found over the years really difficult to deal with in terms of patient concern is, hey, I'm feeling tired, I'm on a diet, but I can't even exercise because I'm so tired.
I'm exhausted and I can't drag myself to the gym. Particularly now when it's, you know, pitch black and it's freezing cold.
Exactly.
And it's just not the incentive any of us need.
So you've got a lack of energy. So, you know, the new treatments and one that we're going to be talking about today are there to also replace that energy and boost that energy, so you can actually do these things without sort of forcing yourself and not even enjoying the journey, which is one of the main reasons why people's New Year's resolutions quickly fade by March, April time.
Yeah,
because
that's so
like,
true.
I'm just sick and tired of it.
They've fallen out of love with this whole new them. And I think we're definitely seeing this shift towards treatments that sort of empower patients, you know, to really think about their physical appearance in a different way. You know, it's not just about getting skinny and thin anymore. It's about strengthening. It is about energizing, exactly as you say.
Feeling good about yourself. I mean, that is basically what we do. There's a huge psychological element here. And there's a number of hormonal releases that happen that can dampen your mood. And one of them, obviously, is not eating correctly. Coupled with the fact, like you've mentioned, it's darker, there's less sunlight. You know, that affects your mood. So these are all things that we have to consider when a patient comes into the clinic, and now we actually have the tools to deal with it, which is wonderful.
It's super smart. And I mean, you just touched on the sort of bodily chemicals that are obviously responsible as well for us feeling in this way. Do you find that, you know, chapters of life such as perimenopause, menopause are also having sort of a contributing factor?
Absolutely. So when your estrogen levels drop, generally a female will start gaining weight around the midriff.
Yeah, that hormonal belt.
That hormonal belt that everyone talks about. And they've had stable diet for years. They've actually probably ate quite healthily and actually maintained a good lifestyle and exercise, but they've still got this stubborn area. And this is one of the main indications that we see in the clinic.
Yeah, and it's that sort of vicious cycle as well, isn't it? You know, you start to see that, you struggle with the fact you can't shift that weight.
Absolutely.
And it feeds into not sort of feeling very good about yourself and, you know, obviously sort of having a crisis of confidence in some ways.
Yeah, and everything is there because everything in your life changes when your body shape changes.
Yeah.
From the clothes that you used to enjoy wearing, to maybe even some sports that you like to do, to maybe even going on holiday, sitting on the beach.
Yeah.
These are all things that we think are trivial, but they do have a big impact into somebody's psychological well-being. So if you can help someone with that, then you can really help in multifacets within their life.
And I love the fact that you obviously create this sort of blueprint for your patients as well before they even embark on any of the amazing treatments that you offer here. I mean, what's the greatest barrier from your perspective for patients who are even coming, you know, to have a body treatment here? Like, what are the things that might prevent them from taking that first step?
I think there's a lack of knowledge in terms of what they're trying to achieve. So I first bought a body device probably 12, 13 years ago into the clinic.
Yeah.
And I now call those devices body shaping devices. They don't help you lose weight. So
it's a much nicer term to use, shaping.
Absolutely.
It's also inclusive and it's democratic in saying everyone has their own unique shape and we're
Absolutely, and you're
that.
enhancing it, you're making it a little bit more probably how it used to be maybe even 4 or 5 years ago. So body shaping is the way that you have to look at this.
Yeah.
For 99% of devices there. Sometimes if you look at patients, well, they've come in and they're unmotivated and then they want to have a body shaping device to maybe reduce abdominal circumference. If they're not motivated, then it's not going to work so well for them.
Exactly.
These treatments are proven to work. So for example, we talked previously at a conference about the emerald laser and how in the clinical trials, everyone ate the same thing. All the participants within the study ate the same thing, didn't change their exercise, didn't change their diet, anything, and they still lost weight. Yes, you can get, technology has got there now, but to get the full maximal benefits and long-lasting benefits, if there's not a change in mindset, then it's going to be really tricky because both doctor and the patient are going to be unhappy by the end of the process.
That's so true. And there's nothing worse than as a patient and probably as a doctor from your perspective than seeing time, energy, resources all wasted and it just being like another gym membership that people have bought and not followed through on and done their part.
So I think, adequate assessment when the patient comes in, seeing exactly what they need and also determining whether the change that they want can be achieved non-surgically or can be achieved surgically. So over here we do everything from non-surgery to surgery.
Yeah.
So we can kind of weigh up, kind of risks and benefits or help that process with the patient.
Yeah.
And once you've set these expectations, then you can make a treatment plan.
Exactly.
So it's not a quick fix, it's a change in lifestyle and a change in approach.
Yeah, it's so true.
And that takes time sometimes.
It's a doctor-patient relationship, and I think people sometimes forget that when they start dabbling in aesthetic treatments. They think it's something purely cosmetic, and they forget all of the groundwork that has to be laid in order to really get good results.
Absolutely. So, look, it's about. I always say to patients, but anything within aesthetics is just like growing crops as a farmer. If your soil is not fertile, if you haven't rotated those crops over the years, if you haven't put the nutrients into the soil, then how can your crops grow?
Yeah.
They can't.
Nice metaphor, I like it. So earlier you were talking about the sort of hormonal belt, the sort of midriff section that can really be bothersome to, I suppose if we're talking about menopause, that's a female patient, but these are obviously treatments as well that I'm sure you see plenty of male patients coming in for.
Absolutely.
Is it always the midsection that is that bone of contention for the patient?
Not always. So there are some areas that surprise me sometimes in terms of what affects patients. Yes, the majority is in the abdominal area. Thighs are quite a big indication, as well as arms. So loose skin, as well as some excess fat around the arms as well.
And I guess that's an educational piece, isn't it, on is it loose skin or is it fat?
Exactly,
and
that's part of the assessment.
Yeah, and then you need the modality to treat it. That's all super interesting. Now we've got next to us the Erchonia Emerald Laser. So this is, I wouldn't say it's a new addition to your clinic, but it's certainly a super high-tech, quite revolutionary piece of kit, isn't it?
Yeah, so I've been working with Erchonia laser and an emerald laser in particular for probably now nearly 2 years. So
I think you were one of the first in the UK to bring it on board.
So when I first heard about this technology, I was already aware of low-level laser technology, which in simple terms is this is a cool laser. This does not emit heat.
So it's not going to burn you, which would be a lot of people's fear instinctively about laser if they hadn't had it.
Absolutely. So this is a cool laser. You don't even feel it working. And I had seen some early papers looking at low-level laser and fat reduction and actually pre-liposuction. So there's a great study that looked at exposing 532 nanometer cold laser wavelengths onto fat prior to liposuction.
Oh, interesting.
And when you perform liposuction, there's an aspiration scale. So how easy is it to aspirate the fat when you're in surgery?
How easy is it to get it out?
To get it out.
Yeah.
So, how much sort of pressure you're using to take out the vacuum, for instance.
Yeah.
That was significantly reduced when patients were exposed to just 20 minutes.
So this almost loosens the fat?
It almost emulsifies the fat, and we
Yeah.
can talk about a little bit later about how exactly it works on the fat cell and how it's different from pretty much any other technology on the market. So that was the first indication that said to us, well, there's something going on here, because this is making that process easy. And actually, prior to liposuction, yes, we do just put 20 minutes in, and it really helps.
So you do this with your pre-lipo patients as well?
Yeah, it's a pre-op.
Wow.
So literally just before they go in, quick flash of 20 minutes, and it can really help with taking out the fat.
How interesting that like a non-surgical device is now being used to prepare the body for the surgery.
Absolutely, and there's multiple different benefits that you can get from this. So if you look at how the emerald laser works, it's very simple. We've got our fat cells that I like to say sit there like a brick wall. Mm-hmm. So you've got the fat cells sitting there, and then you've got the cement in between.
Yeah.
Okay. And fat is an organ. So fat is something that we need. Yeah. So it does a function.
Yeah, that's so true.
It's a collective group of cells. Mm-hmm. So it helps with our homeostatic mechanisms. It helps with your metabolism. It helps with even sexual health.
Yeah.
There's a number of things that fat do. And also it helps you survive if you're in a mountain, and it's energy stores. Yeah. So it's a source of ATP. ATPs are our currency for energy within our body. Right. So when this first came out, it changed my thinking on fat, because I thought to myself, why are we trying to get rid of this fat? Because when you put on weight, your fat cells become bigger. Mm-hmm. Sometimes there's some studies that say that they do multiply within numbers, but most of the time
they just enlarge and they take on more bulk.
Absolutely. So this enlarged fat cell that was supposed to do a job is suddenly not doing as good of a job as it's supposed to do, in comparison to a leaner, meaner, more efficient fat cell.
That's so true. It's almost like the lazy counterpart.
Absolutely. It's sluggish, and it's, it struggles to get moving. These are things that if you feel like, on January the 1st and you want to make a difference, that's how we all feel, right?
Exactly. We all feel
so
like
it's a reflection of what you're feeling at the time. So it's no surprise. So our aim really is to say, well, actually, look, these things do a function. Let's just shrink them back down to what they're supposed to do. Yeah. And collectively, if they're leaner and meaner, then your metabolism increases. So then your weight will also drop later on as well.
Exactly. It's a nice way of thinking about it, actually, to almost see the positive gain of having fat, but actually, as you were saying, almost optimizing that fat cell, making it the type of meaner, leaner fat cell that you spoke about.
I mean, look, we do fat transfer to the face. Yeah. It helps stimulate collagen within the face.
Yeah, exactly.
So should it not stimulate collagen if working efficiently on your buttocks or on your thighs?
But fat has been demonized so much over centuries.
Absolutely, and we shouldn't be looking at that. So look, when you're exposed to 532 nanometer wavelength in laser, it creates a transitory pore within the membrane of the cell.
So it perforates
small
that sort of
perforation.
Membrane.
Yeah.
Right.
The intracellular fat emulsifies and then becomes extracellular. So then your lymphatic system then helps drain that. So post-treatment, post even 20 to 30 minutes exposure, we always do lymphatic drainage afterwards. And immediately,
like a hands-on manual lymphatic drainage, or like a compressive
There's
suit.
a compressive garment.
Yeah, exactly.
Yeah. So, and actually patients that are, and you can treat a whole abdomen within 20 to 30 minutes.
Yeah.
Because they're circulating lasers. So you just need to lie on your back and then lie on your front.
And 15 minutes. You flip sort of halfway through, don't you?
And it's done. So, and that's full circumferential, which actually is very difficult to do with other devices that you have to manually put on.
And it's amazing because you simply lie beneath these sort of very beautiful sci-fi emerald green laser beams, and it sort of looks like, how can that do anything?
And actually, we've had a number of journalists come in, have the treatment. We've measured them before, measured them afterwards, and you see it immediately. And we know it works because we've got the studies, and we go back to that
Exactly.
initial study that I talked about.
But how many sessions are you looking at to sort of get that noticeable reduction in circumference?
Well, we start as a minimum with 6 sessions.
Yeah. Is that sort of once a week, or how often?
You can do an accelerated course, so you can do twice a week.
Right.
If we've assessed you and we feel like your lymphatic drainage can handle it, for instance, then we say, okay, quick, we can do an accelerated course, or you can do it weekly as well.
I guess it's whatever fits into the patient's diary and what is going to be sustainable for them.
Absolutely. And look, this device is actually FDA approved for obese patients.
Yeah, because you can treat anyone with a BMI, not anyone, but patients with a BMI of over, or is it up to 40?
Up to 40.
Up to 40. And that's incredible. I don't think there's probably another device on the market, is there, that does that?
There isn't. And so if you're talking about number of sessions, somebody that's at a BMI of 40, and, obviously in clinic we've done it with patients that are even larger than that.
Yeah.
And they have more sessions. So sometimes they even have a session a week for a year.
But it's nice as well, because going back to that conversation on New Year's resolutions, you do sometimes need something that is going to kickstart that healthy approach. And I do think it can be very disheartening for somebody potentially who has got a BMI of 40 to be told, before you can even step foot into the clinic, you must lose some weight.
Absolutely.
And this is almost the kickstart for them.
I mean,
right?
and that's what we always say in our team meetings with our therapists, is that, look, this opens up treatment indications for patients that really want it and feel like they need it.
Yeah, exactly.
Rather than the traditional, what people think is it goes on in aesthetic clinics. I've got a little bit of fat.
Yes, I know, on the back of my wrist.
I can take it
on
from
my
here.
knees. Yeah.
So, and this makes a real difference to patients' lives. Now, part of this process is that it upregulates ATP. So
what does upregulate?
So you get
mean?
production. So let's just, we talked about the currency of energy within our body, ATP. That's made in our mitochondria. So these are cells that sit within,
Like
it sits within the cell, and it's like a little battery within the cell. If we're low on energy, we're low on ATP. So exposure with this laser, it actually results in 4 times the amount of ATP in
so
production.
it almost stimulates what the
You're charging
mitochondria?
it. Yeah,
recharging the batteries.
So you're recharging it. You're just plugging in your electric car to go for longer, and that's what you're doing.
How interesting.
So
like the Tesla of body shaping
it
devices.
pretty much is, to be honest. And I like my Teslas. I like my electric cars.
Do
So
you have one?
yeah, I've got too
course
many
you do.
to say really on camera. But
Lol.
so once you've got more energy, you can say, well, look, I'm reducing fat. My circumference is decreasing.
Yeah.
I'm now getting more energy. My homeostatic mechanisms are better. And actually, now I can really go hell for leather. So you can exercise more, for instance. So,
and then obviously enhance those results tenfold if you're doing the exercise at the same time, which previously you may not have had the energy to do.
Absolutely. And this wavelength, yes, it works for fat reduction, but increasing ATP also increases things like vascularity later on down the line through certain pathways. And it can actually be used in improvement with things in like injuries.
I suppose because it's accelerating the healing by spurring vascularity, by enhancing circulation. It's getting the oxygen moving around the body.
Absolutely. So, we've used it, kind of on Instagram. You might have seen some famous singers and stuff coming in. I think Anne-Marie, she twisted her ankle when she was on one of the tours, and she came in, we just put the emerald laser on it, and she was ready to perform literally in a matter of a week.
So it's sort of pain relief and accelerated sort of recovery as well for people who need it, which is interesting because it also means it's tripping out of not just the aesthetic arena, but into a more rehabilitative
Actually,
space
and
as well.
Erchonia lasers have specific lasers for pain as well.
Yeah, they have some amazing things in their portfolio.
Absolutely.
You told me once you were trying them all at your house. You had like
I have all of them. There's a handheld one where you can stimulate your brain and all sorts of things.
Are you going to bring that one into the clinic?
We have. It's an add-on that we do with the emerald laser. So if you want to stimulate, because everything is like we talked about at the beginning. We're treating the physical, but we also want to treat the mental as well.
Yeah, that's so true.
So if you can improve your mental stimulation, then you can improve your concentration. That will help with your exercise. All of these things go hand in hand.
Yeah. No, it's such an amazing piece of kit. There's one thing I wanted to ask you, which is I think sort of new studies into cellulite and the laser wavelength of the emerald. How have you been treating cellulite with it?
So we actually at the time of the FDA approval for fat reduction, there was an approval for cellulite not so long afterwards.
Yeah.
And it's a little known fact about the emerald laser. Now, I think cellulite is extremely stubborn to treat.
Yeah, everyone always says this.
And I've tried numerous things over the years, even surgical, like actually breaking down the cellulite.
Trying to like subsize the sort of little bands that
subsize the
it.
bands. And for certain cellulite, that does work. I would say for sort of low-grade cellulite up to a sort of moderate cellulite, emerald laser actually produces a profound difference.
Yeah.
That's mainly because you get a little bit of increase in skin thickness as well.
Oh, interesting.
But it's not, the treatment of cellulite also you have to break those septic down, like you mentioned, those fibrous bands. But in conjunction with other treatments that you might offer in the clinic that are designed to create a little bit more kind of, let's say, friction underneath the skin, then it can work very well. Now, as a byproduct of being treated with the emerald laser, we've noticed some improvement within cellulite as well. So
the skin thickening is really cool, though. I guess by thickening the skin, you're creating a healthier skin, but you're also then hiding the lumpiness and the fat below the surface.
Exactly. It's much how we would like to do when we're on the face, for instance. So we have collagen stimulators, such as Sculptra, which is proven to obviously increase skin thickness.
Yeah, exactly.
And that actually sometimes makes more of a profound uniform difference than just targeting one area.
Yeah, it's so true. And I think with all of these devices as well, it's important to sort of look at it from that overall holistic perspective and not just sort of the spot targeting certain areas.
Yeah, no, and look, everything, don't be, the emerald laser is a fantastic machine that works for the right patient.
Yeah.
Now, I have other body devices in the clinic, and the reason why I have other body devices in the clinic is that I might have somebody with very little fat that maybe wants to develop their muscle, and they want to think about the M-Sculpt Neo, for instance. They might want a specific cellulite treatment, and then you can use another treatment. And so you might get a patient that wants to treat multiple different areas with multiple different modalities.
Yeah.
So the emerald laser, the fact that it's hands-free, it can be put on the tummy, you can put on the thighs, even the ankles to reduce ankle size, and then you can work on another area of the body at the same time.
It's nice that it actually sort of complements, I suppose, the other things that you're doing.
Yeah, so patients are getting a truly bespoke treatment rather than saying, well, this one treatment should treat absolutely everything.
Exactly, which is, there is no silver bullet. There is no one thing that is probably going to do that for you. I mean, speaking about the other body shaping devices, what sort of, I suppose, how can you make a patient feel less anxious? Because obviously there are other fat freezing devices that have had a bad rep. Patients are sometimes scared of the adverse effects that these machines can have. How does the emerald sort of laser
So we talked about how it works. So it does not destroy that fat cell.
Yeah.
It preserves the fat cell. So actually you're not damaging anything within this process, which I think is, if I were a patient, I would say to myself, that's actually quite appealing, because I know I'm not doing any long-term damage. In fact, I'm doing the opposite. I'm actually improving my health. I'm improving my well-being. And this is not just a fat reduction device. This is a well-being laser, really, because it's improving your well-being.
Yeah,
That's
exactly.
It
ticks all the boxes.
It's the first of its kind. So when we looked at paradoxical adipose hyperplasia, which basically means developing fat in other areas of the body after fat has been removed. And there was a particular case, obviously, with Linda Evangelista, where she had fat freezing previously, and then she started developing tough, fibrous fat in other areas of the body.
Yeah.
That scared a lot of people.
Exactly.
And fat freezing got a bad name, but that applies to every type of fat destroying. That applies to laser assisted.
It's not just the fat freezing.
That applies to radio frequency.
Yeah, exactly.
But we need to remember that incidence is extremely low. But with emerald laser, there isn't that risk because of the mechanism of the way that it works.
Yeah,
so if
that must definitely put people's minds at ease.
Absolutely, and it's not to say that it doesn't work as effectively either, because we don't perform fat freezing here at DrMedispa.
Do you not? So this is your go-to when it comes to wanting to shift some.
Yeah, I mean, you're in this
unwanted
room,
bulk.
you can't see a fat freezing room. This is the body room, right?
Yeah, it's so true.
So we don't do it. We either do obviously a whole course of emerald laser, or we then mix and match in terms of bespoke for the patient. So I firmly believe that we have to move on, and just because something doesn't hurt, it doesn't mean that it doesn't work.
I think the no pain, no gain adage is sort of, very much sort of forgotten about now.
Yeah,
hopefully.
absolutely.
But I like your approach as well, and I think it's very much about, firstly identifying what the patient needs from that DNA perspective, but then also offering them a sort of combination approach to their sort of bespoke issue. And that's the only way you can really affect, long-term sustainable change for a patient, which January is the holy grail to achieve, frankly.
And it is, and I think, look, it's stood a testament of time, because I, unfortunately and unfortunately, have had purchased many a machine over the years, and there's always what I would say a honeymoon period with devices, that you treat every patient with it, you're really enthused with the technology, and then it sort of tapers off.
Yeah.
And the true test is after 6 months, patients saying, "What? Can I have that treatment again?" And you get that with the emerald laser. So
patients actually come back requesting it again.
And actually, when I had the treatment, I had 6 sessions, and I didn't know the excess energy that I got. I mean, my jeans and stuff felt looser. I didn't realize about the extra energy that I had until probably about 4 or 5 months down the line, when it wear off.
Oh, that's so interesting. So you
when
actually noticed a sort of depletion in your energy.
And I was like, okay, so I need to maintain this.
I need to get one of these in my garage.
And actually, I was quite pleased, because I thought to myself, actually, it took about 3 or 4 months for that energy level to wear off. And if patients come for even 3 or 4 sessions here and there for the year just to maintain, then that's absolutely fine. And imagine your fat is reduced, your metabolism is already increased.
Yeah.
So even beyond the treatment, you will continue to lose weight. And
that's incredible. And also, you have sky high energy. I mean, what else could you want?
Yeah. And especially in my job. So yeah.
And mine.
Yeah, exactly.
That is all really, really interesting. I'm so grateful that you managed to find the time to have this conversation and tell us everything about the emerald. You're so scientific the way your brain works, and you talk so articulately about all the technology. So it's been a real joy to have the chat. But thank you. And I hope everyone enjoyed the conversation. Do reach out to us if you'd like any further information on the Erchonia Emerald Laser, or indeed Dr Munir Somji here at DrMedispa. Enjoy the rest of your January. Happy New Year, and see you all soon. Thanks.